This is a 30-year-old gentleman who had come in with hematuria and so got a hematuria protocol CT scan. So we'll start off with the non-contrast portion of this study. You can see that the kidneys look okay. There's no real hydronephrosis. But as we go down, we'll start to notice that the distal ureter looks a little bit abnormal. Right around there, you can see it, a little thickened, a little fleck of calcium. As we go down even lower, we'll notice that it's even more thickened as it goes distally. Another fleck of calcium over there. Subtle calcifications, but they're there, and there's all this thickening and a little bit of stranding surrounding that distal left ureter. So a finding that one certainly needs to pay attention to as we go through our other phases. If we look at our excretory phase done at around 8 to 10 minutes, you can see that the collecting systems and ureters, at least the proximal to mid ureters, look okay. But as we start to get the level of the pelvic inlet, we're going to see that there's a fill-in defect protruding into the left ureter over there. We can see it nicely over there as well. As we go downwards, we can see some fill-in defects and significant thickening of that distal left ureter. That really is in the same location as some of the stuff we saw in the non-contrast portion, and some of that areas were calcified. And so really have a few fill-in defects, thickening, calcifications associated with the distal left ureter. In this relatively young patient, certainly need to be worried about a urothelial carcinoma. But another thing to sort of think about when you see these calcifications would be other infectious etiologies such as tuberculosis and schistosomiasis. This patient actually underwent a cystoscopy and a uteroscopy, and all these findings turned out to be secondary to schistosomiasis.